Informed consent is one of the most important moral concepts in all of bioethics, and it is the centerpiece of our discussion today. Many of us have signed consent forms, usually very quickly, in doctors' offices or in a hospital, and we know that a mere signature on a form is not an informed consent. A so-called consent form may be no more than a legal release of responsibility for any harm that might occur when a doctor treats a patient. Such consents given by patients are often uninformed, even though a hospital or other institution regards these consents as informed because, after all, they are signed. Are these consents valid, or are they invalid consents? Let's start to work on this problem with an example of a consent issue. Several years ago, an 18-year-old patient named Jesse Gelsinger died in a gene transfer study at the University of Pennsylvania. He'd suffered brain damage and organ failure. He had a rare metabolic disorder when he went into the experiment. He was relatively healthy at the time and had been doing fairly well on his medications and a special diet. He entered the experimental study largely to contribute information that would help other patients in the future. He knew that he was in an experimental study and had consented to his involvement. But significant problems emerged about whether his consent had been truly informed. First, there had been no disclosure to him of the fact that 2 monkeys had died in this research prior to the use of human patients as subjects. The consent form given to Gelsinger had suppressed this fact, although it had been in the consent form that had been officially approved for use in the study. Second, there had been no disclosure of some adverse reactions that had already occurred to some human patients in the study. As Jesse's father, Paul Gelsinger, later testified, the potential benefits of the research had been oversold to him, and the risks of the research had been unduly minimized by the research investigators. The father was convinced that the signed consent form was therefore an uninformed and invalid consent. What then does it take to be a truly informed and valid consent? A little history will help here. Requirements of informed consent did not have great impact or receive detailed examination in either law or bioethics until roughly the early 1970s. Physicians at the time strongly resisted these requirements. They saw obtaining a patient's informed consent as burdensome, and they thought patients couldn't truly understand medical concepts and doctors' explanations of diagnoses and proposed treatments. They wanted the subject of informed consent to just go away. However, the goal of protecting the autonomy rights of patients by an informed consent turned out to have great staying power in bioethics and law, and requirements of obtaining valid consents from patients became the moral basis of the right to authorize or refuse medical care. Virtually all prominent medical and research codes and institutional rules of ethics gradually came to state that physicians and investigators morally and legally must obtain the informed consent of patients and subjects prior to any substantial intervention. Laws requiring consent have often indicated that disclosure by physicians to patients is the central element in informed consent. Physicians have similarly reacted. Some polls of physician opinion have indicated that physicians regard adequate disclosure as more or less synonymous with informed consent. But this view is untenable. It's very far off the mark. No doubt it's important to have adequate disclosures by doctors, but they do not constitute informed consents. From the moral viewpoint, by contrast to some legal viewpoints focusing on disclosure, informed consent is much more. Informed consent has primarily to do with autonomous decision-making. If there is no well-informed, autonomous choice, an informed consent simply has not been given.